On today's episode, we will be discussing how to handle quote unquote failure as a pre-health student, medical student, resident, in training physician, and in life in general. Recently, I've been running into this topic and wanted to take a minute to address it. Welcome to the Becoming Latina Physicians podcast, a place where I share my journey to becoming a physician, as well as the stories of others in our community to help inspire, mentor, and equip current and future Latinas on their successful journey into medicine. I'm your host, Dr. Alanis, a board-certified diagnostic and interventional radiologist. Join me in our trailblazing community as we share stories, inspire, and mentor each other to thrive in medicine. Get ready to learn, grow, and become resilient, friends. We need to acknowledge that you may need a break from studying for an exam or taking an exam or other responsibilities like committee meetings and extracurricular activities. I think that as Latinos, we tend to feel like we have to prove ourselves, prove that we belong here, prove to others that we are smart enough, tough enough. But I believe it's that imposter syndrome that takes hold of us. We have to remember that we are in medical school, in residency, and at this job because we are qualified. I mean, those on the admissions committee know that medicine is difficult, and if they didn't believe in you, you would not be there. Now, I understand that there are many roads that lead to medicine. Sometimes your road may not be the same as your colleagues, and that is okay. I, for example, was considered a non-traditional candidate for medical school. As I mentioned in the prior episodes, I took the MCAT 3 times and applied to medical school twice. I kept going because I believed in myself and I knew that God had a plan for me, and there were so many people in my life that were rooting me on. I also want to remind you that it is okay to ask for help with your studies. You want to seek out tutoring, you want to be proactive. You want to look into prep courses, question banks. You need to be able to be comfortable to ask for an extension if necessary. Learn how to set a study schedule. You have to remember you are your best advocate. And if you don't communicate these needs, no one is coming to ask you if you need these things. The goal is for you to graduate, and they are there to help you achieve this. You also want to learn to set boundaries and get comfortable with saying no. I was able to overcome these hurdles because I asked for help. I took prep courses, I set a studying schedule, and I let my family and friends know that I was serious about becoming a physician. You know, it's challenging as a Latina because in our culture, we are expected to attend all family functions/events, quinceañeras, baptisms, bautismos, weddings, carne asadas, barbecues, cumpleaños, birthdays. And it so happens that there is at least one of these every other weekend. And we have to be able to say, I'm sorry, I cannot make it. You got to learn how to set boundaries because in the end, the goal is for you to become a physician, a healthcare provider, physician's assistant, a PhD graduate, whatever your goals are, whatever you set, remember that is the road that you need to follow. And it is difficult for us because when we stop showing up, people will talk. They will ask, where are you? Why are you not at the gathering? Are you feeling sick? What's more important than family? Unfortunately, some family and friends will not believe in your big aspirations. And you know that it's okay because that's their opinion. Remember, you have to prove those that believe in you right. There will be family drama, and you have to learn how to navigate your family drama. I had to learn to navigate my own family drama in undergraduate school because it was affecting my concentration on my studies, and ultimately my science GPA suffered. Again, I sought tutoring, and I actually had to distance myself from my family for a bit. After a while, I was an adult, and I should not be responsible for quote-unquote fixing the issues. But here lies another Latina issue. As the eldest daughter/only daughter, you are expected to care for your parents and siblings. Since when? I mean, this is part of our culture, but why is this a thing? And it comes down to you can't help others if you cannot help yourself. And I know that that was a very difficult conversation to have with my family. But looking back on it, I think that they were able to comprehend eventually that I really needed my space, and I really was there because I was serious about becoming a physician. And, I've learned after all these years that setting boundaries is healthy. If you are absolutely required to attend gatherings or help with your family households, make sure to commit 1 to 2 hours of your time. The rest of the time should be set aside for your studying, working out, and taking care of yourself. And remember, this is not selfish. Self-care is not selfish. Again, failing exams will happen. Sometimes this happens when it's just not your day. You may not have slept well, you were sick, you completely blanked out during the exam. You didn't prep for the questions that were asked. And sometimes it could be the result of a technical issue on the day of exams, which can throw you off. And I know this because it's happened to me a couple of times. And that was extremely stressful, just seeing the whole screen just kind of go blank and wondering, well, there goes that exam. But, when it happens to you, you may feel like a quote unquote failure, like you don't belong, you're embarrassed, you're depressed, if others find out. But I can tell you now, looking back, it's just an exam and it doesn't define you. We can always change your game plan and try again. And remember, you will not be the first nor the last to feel this way when it happens to you. Not everyone talks about this, especially if you're a minority in the group, because again, you'll feel embarrassed or depressed. I personally failed many exams and developed anxiety because of it. However, I was able to overcome it by changing my mindset and giving it all I had to studying so that on the day of the exam, I could prove myself that I did everything in my power to pass this test. I have strong faith, and I believe that God only gives me what I can handle. Reflecting back on these moments, I've learned that they helped me become the Latina physician I am today. When one door closes, I look for another door or window. My favorite book that helped me get through these tough patches is The Last Lecture by Randy Pausch, who was a professor of computer science at Carnegie Mellon University and passed away from pancreatic cancer in 2008. He wrote this book to share his experiences prior to his passing and to encourage children and adults to pursue their dreams. If you are short on time, you can watch or listen to his lecture on YouTube. It's about an hour long, so plan accordingly. It's called just Google Randy Pausch Last Lecture, Achieving Your Childhood Dreams. And, I just want to share one of my favorite quotes with you. He says, "The brick walls are there for a reason. The brick walls are not there to keep us out. The brick walls are there to give us a chance to show how badly we want something. Because the brick walls are there to stop the people who don't want it badly enough. They're there to stop the other people." So just remember, keep moving forward, keep your head up high, ask for help. You are in control. Having said that, some things will be out of your control. Life happens. When it rains, it pours. Life is not perfect no matter how hard you try. You have to switch your mindset and work with what you have. Becoming a physician requires tenacity and perseverance. I have come to believe that we as physicians enjoy pain. We somehow seem to find ourselves in situations that would have made anyone else run in the opposite direction. So you have to accept the fact that you cannot be in control of everything and seek the help and assistance that you need. For example, you can reach out to trustworthy family, friends, or mentors and discuss with them your situation. Sometimes even just talking things out will help you find the solution yourself. I will also let you know that therapy works. You can sign up and get a therapist confidentially. There are many Latina therapists out there, and all it takes is seeking them. Again, culture and language matter, and it's important that you find somebody that you feel comfortable with and who will also understand where you're coming from. Because as Latinas, there are some deeply rooted beliefs, idioms, cultural norms, cultural expectations that not many other people may understand. So again, it helps to find someone similar to you. But the bottom line is to take care of yourself and take care of your mental health. Lastly, I want you to believe that things will fall into place. Have faith that your hard work and efforts will pay off. You may not understand things as they are happening, but maybe in a month, 6 months, a year, 6 years, 12 years, things will become clear as to why you had to go through that lesson. Your journey and timeline will be different than others, and again, that is okay. These experiences will enrich your life story. Many like myself have failed multiple times, and here we are, practicing medicine, helping other communities, helping our communities and living our best lives. The most successful people in life have failed the most times. They usually fail, and we usually fail daily if you think about it, but we keep going, and that is the most important thing. So for anyone out there who's listening, who has failed an exam, remember, I believe in you, we believe in you. You will overcome this. You will pass. You will match. You will get that job. Do me a favor when you get a chance, even if you sketch something somewhere. Create a vision board. Write/draw out your wildest dreams. Hang positive affirmations in your environment, because I truly believe these work. I will share my vision board from June 2001 on the Becoming Latina Physicians podcast on YouTube. My name changed, the name of the hospital changed, and one of my many goals changed, but overall, I hit all of them. But I am not done yet, and neither are you. Adelante. Thank you for tuning into the Becoming Latina Physicians podcast. Remember, your journey in medicine is not just about becoming a doctor. It's about the journey and the person you become while empowering others along the way. If you enjoyed this episode, be sure to subscribe at Spotify, Apple Podcasts, or wherever you get your podcasts. And remember to share this with others who need to hear this message. Until next time, keep shining bright. See you at our next appointment.